broken families, people living under bridges, an anguished mind descends into violence. All around us, we see the results of a failing community mental health system. We see it because we are on the front lines. We are community mental health workers. And for too long, our public leaders have been failing the mentally ill and our communities. Now we're doing something about it, and we want to tell you our story because it is your story too.
Our clients don't die from suicide. That's what people always think about. They die because somebody wasn't there to make sure that they went to their doctor to find out they had high blood pressure. We didn't have a nurse that could monitor their weight to know that they were developing diabetes from a side effect from their medication. That's how we lose people. The crisis is already here, and it's been here for a while.
The turnover is 33%. That's 1 in 3 workers. When you have that much turnover, you're inevitably going to have a huge amount of people recycling through the system.
Without those professionals that have that ability to step aside from their own judgment and make sound, healthy, loving, caring, compassionate decisions for another, it just would not be an effective system. The mental health system would collapse.
And it has been my passion to work with people who are mentally ill, and that is where I studied. That's what I studied, and I want to put whatever I studied into practice.
When our passion runs headlong into the practical realities of raising a family, paying a mortgage, or just paying off a school debt, all too many of us are forced into making a tough decision about getting another job that pays better.
This last year we had a really good intern. We have a lot of interns who come through, but she did a particularly great job. And it was a master's degree internship program. She made a great transition from that into being an employee, which a lot of folks don't want to stay in the field, and we were really happy to have her. Unfortunately, once she started working as an employee, she realized that she wasn't going to be able to pay her student loans and pay her rent. And so, reluctantly, she had to leave community mental health to go into something else in order to be able to support herself. And it was a big loss for her clients and a big loss for the rest of the staff.
Being in a career in mental health has been a challenge recently. The cost of housing, even where I live in rural Skagit County, has exploded, and it's becoming very difficult to continue considering being a worker in mental health.
You know, there's a reason when you're in the airplane, the stewardess says you need to put your own oxygen mask on first before you try to help somebody else. And the reason is because if you aren't breathing, they're not going to be breathing either. You know, and so we have to take care of ourselves.
Last year, mental health workers dared to imagine a campaign that would change the system.
Community mental health workers gathered together and decided that they would come up with a plan to go after the legislature to help provide money. And money that would go to things like wages and benefits, things that would keep people wanting to do the work and able to do the work. And also, we want funding so we can stop losing the services that we know our clients really need.
When people first raised the issue about needing additional funding, my colleagues in the legislature were interested and concerned, and they knew it was a problem. But, you know, there are a lot of funding issues in the legislature, and we have lots of different priorities, important things that we need to fund, and so it was sort of difficult to sort of make this rise to the top.
Hundreds of people sent postcards, thousands of people sent emails. We had folks that took days off from work to go down and talk to their legislators in the hallways outside the meeting rooms. People had things they could do, and a variety of things. And everybody did what they could.
More and more workers came to talk to my colleagues. My colleagues really began to identify with this issue. They would sometimes then tell the workers stories about folks in their family that were affected by mental illness, or a colleague's son, or someone that they knew. And they really began to see the gravity of this issue and that this was essential to have in the budget. And so at that point, I had my colleagues coming up to me saying, now, is this money going to be in the budget, Tammy? And who can I talk to help us to get this money in the budget? And they really became our allies in getting this funding for this issue.
Well, at that point we realized the legislators were beginning to listen to us. They were asking us questions about how things really were in the work. But it was also obvious that that wasn't going to be enough. We needed to do something bigger, something bolder. At that point we voted as members to take a one-day strike. And we did that. We all went down to Olympia. There was over 300 of us. We went down there as a group to make our voices heard for community mental health.
I think it's a new phenomenon, having people that are actually delivering mental health services becoming actively involved in the advocacy for greater resource to serve people more effectively in the community.
The supervisory staff actually, they let us have time off to go down and actually do some lobbying at the legislative level. They've been very supportive of us taking time to do that. It's true we did have this one-day strike that we all went out to show our solidarity, but they were supportive of that too.
At West Seattle Psych, I stood up in a bargaining meeting. We were negotiating a new contract, and said that according to the principles of enlightened self-interest, the administration should support the endeavor in which we're engaged to get some more money for the frontline workers from the legislature, and they agreed with us. And they actually put a pool of money out that would pay people to go down and spend a day in Olympia.
On April 12th, more than 300 mental health workers converged on Olympia and called on elected officials to address the crisis in our mental health system. And when the legislature passed their final budget, they included $24.5 million in new funding just for improving staff wages and benefits.
It was an amazing feeling to realize that all the hard work we'd done, that people in Olympia had really listened, had really heard, and to see the actual budget and see the numbers and see how it was written. I'm a little bit speechless, I guess. I mean, I was ecstatic when I read it. I just wanted to kind of run down the hall, you know, yelling at people, "We did it, we did it!" For me, I caught wind of hope, I guess, from this whole campaign and realized that there was really something we could do. And then the more I got involved, the more I saw, man, we are doing stuff. And that lit a fire for me. So I just thought that was awesome. I just could not participate in something like that.
The thing that's meant the most to me, or been the most important to me about being part of the union, is the fact that you get connected with other people who do what you do and have the same values you have to do this work. They really have the same sort of vision. They have the same sort of things they want for their clients, the same sort of things they want for their community. And you make those connections with them. And when you do that, then you move forward. You make real change.
Being in a union helps me feel like there's hope for mental health.
I was very excited to see the gains that you guys had made in Olympia this year. And that gives me great hope that effective partnerships between management and labor is a very powerful tool to help this system achieve what all of us want, both mental health case management staff working in the trench, clinical directors working in mental health centers, executive directors such as myself. I think we all do share a common vision, and we all should be operating in concert with one another to truly transform the mental health system in the state of Washington.
I think it was really essential that we were able to be successful in getting this funding, because a couple of things happened from that. We were able to stabilize the workforce, and through that we'll be able to deliver quality care to folks. Certainly this is only a first step though, because I really have a vision of the workers, the heads of the agencies, the management, and legislators like me all coming together to really move mental health forward in the way that I see it needs to go. And that is that we have a seamless system, that wherever you're mentally ill in this state, there's no wrong door, and we're able to provide quality care for folks.